Hello, my name is Madeline Cripe. I am a senior majoring in psychological sciences and minoring in criminal justice. I've had the privilege of working under the supervision of Dr. Sumner Seidman for the last 6 semesters.
Hello, my name is Emily Lucas, and I am also majoring in psychological sciences with a minor in social forensic science. I have also worked with Dr. Simon for 3 semesters here at NAU.
Today we are sharing our work that supports ADHD diagnosis predicting JUUL use in young adults. I, Maddie, will be covering the introduction and method sections.
And I, Emily, will be covering the results and the discussion sections of our presentation.
According to the DSM-5, attention deficit hyperactivity disorder, or ADHD, is characterized by hyperactivity, impulsivity, and inattentiveness. Hyperactivity can be conceptualized as being often unable to participate in certain activities or talking excessively. Impulsivity includes behaviors like blurting out when inappropriate or acting without consideration. Having difficulties maintaining attention includes behaviors like being able to complete tasks or having low attention for detail. According to the American Psychological Association, the prevalence of ADHD in adults is 2 to 5%, with the most common presenting symptom being inattentiveness. In college students, the prevalence of diagnosed ADHD is 8.4%, which is slightly higher than the general adult population. Over the last decade or so, there have been several studies confirming the relationship between ADHD symptoms or diagnosis with nicotine use. In 2005, Collins found that ADHD symptoms in childhood were associated with conventional tobacco cigarette, or CTC, use later in life. More recently, a study conducted by Glass and Flory suggests that young adults with symptoms of ADHD are at greater odds of using a CTC later in life. Over time, conventional tobacco cigarettes took a back seat as e-cigarettes hit the market. E-cigarettes are devices that look similar to a conventional tobacco cigarette, but administer the nicotine electronically compared to combustible cigarettes. As with ADHD in conventional tobacco cigarettes, a relationship between ADHD and e-cigarette use has been steadily supported by research. First, ADHD symptoms were associated with increased odds of using e-cigarettes in a study on adolescents. Additionally, e-cigarette use is significantly correlated with high rates of mental disorders, including ADHD, in young adults. Lastly, a longitudinal study tracking students from the spring of their senior year in high school through the fall of their freshman year of college concluded that symptoms of ADHD present in high school predicted the onset of e-cigarette use during their first year of college. As you may have noticed in the last slide, I referenced the term e-cigarette. Over the years, various generations of products have emerged that could be classified as an e-cigarette. These products are best described as electronic vaping products, or EVP devices, which is what I will be calling them from here on. The first generation of EVPs are cigalikes. These devices are similar in the shape and size to CTCs. They just administer the nicotine electronically. Second generation EVPs are known as vape pens along with e-hookah pens. These devices resemble the shape and size of fountain pens, with this particular generation of EVPs containing larger batteries and a more amount of e-liquid. Further, the third generation of EVPs are known to be mods or tanks. These devices have modifiable heat settings and allow the user to control the amount of e-liquid placed in the device. We wanted to share the history of EVPs with you all because all of these devices are commonly classified as e-cigarettes. Previous literature assessing ADHD and e-cigarette use failed to specify which devices they are inquiring about. Users of these products may or may not consider their device to be an e-cigarette, which could cause for an underestimate in the rates of e-cigarette use in a study. The fourth generation of EVPs are referred to as pod devices or pod mods. These devices have small pods that contain nicotine salts. When the user inhales from this product, aerosol derived from the nicotine e-liquid is delivered. These products contain a higher concentration of nicotine compared to devices from the previous generations. The pictured product on the side is JUUL, which is among the fourth generation of EVPs. We wanted to share the history of EVPs with you all because all of these devices are commonly classified as e-cigarettes in the literature. Previous literature assessing ADHD and e-cigarette use failed to specify which devices they are inquiring about. Users of these products may or may not consider their device to be an e-cigarette, which could cause for an underestimate in the rates of e-cigarette use in an actual study. The present study is solely concerned with JUUL use for the following reasons. 1. JUUL is the most commonly sold and used EVP on the market. According to the U.S. Department of Health and Human Services, JUUL has more than 70% of the share of the market. 2. Currently, there is no available research on ADHD symptomatology or diagnosis in relation to JUUL use. All of the present literature broadly assesses e-cigarette use in relation to ADHD. All of this brings us to the present study. The purpose of our study was to assess the association between ADHD diagnosis and JUUL use in young adults. We hypothesized that ADHD diagnosis would predict both lifetime JUUL use and past 30-day JUUL use in young adults. Moving right along into the method section, I will be explaining our participants, measures, procedures, and data analyses for this project. For our study, we obtained a cross-sectional convenient sample of 525 young adults ages 18 through 25 that are undergraduate students here at Northern Arizona University. In order to assess ADHD diagnosis, we asked participants this item. Have you ever been diagnosed with attention deficit hyperactivity disorder, ADHD, or attention deficit disorder, ADD? To assess JUUL use, participants were shown 2 pictures of JUUL with the brand name removed, and we asked the following. Have you ever used this device even 1 or 2 times? And, in the past 30 days, have you used a JUUL even 1 or 2 times? After receiving IRB approval, we developed our online survey using Qualtrics. We then administered our survey through SONA, a research platform used by undergraduate, graduate, and faculty researchers in the Department of Psychological Sciences. Here, researchers can post their surveys or advertise opportunities to participate in research. Typically, students in 100 or 200 level psychology courses are offered course credit or even extra credit to partake in these studies. Our study was posted on SONA in November of 2018, and data was then collected from November 2018 through May of 2019. For our data analysis, descriptive data for socio-demographic variables were calculated. Race and ethnicity were dichotomized into non-Hispanic white and all other races combined. In order to test our hypotheses, 2 simple logistic regression analyses were conducted as follows. 1. JUUL ever use was regressed on ADHD diagnosis, and 2. 30-day JUUL use was regressed on ADHD diagnosis. All data analysis and calculations were completed using SPSS.
As Maddie stated earlier, a logistic regression was the analysis of choice given that the dependent variables of JUUL lifetime use and JUUL 30-day use were dichotomous. From analyzing the statistics, the results were that JUUL lifetime ever use and 30-day use, respectively, on ADHD diagnosis indicated that ADHD diagnosis was a significant predictor of lifetime JUUL use, but not 30-day JUUL use. Specifically, individuals with a lifetime ADHD diagnosis were found to be 2.23 times more likely to have ever used a JUUL compared to those that had no history of an ADHD diagnosis. Further, though not statistically significant, individuals with a lifetime ADHD diagnosis were 1.27 times more likely to have ever used a JUUL within the past month. Thus, the hypotheses were partially supported. We also ran several inferential statistics comparing our key variables by comparing demographic groups. While we did not hypothesize about these findings, we found no differences in rate of self-reported ADHD diagnosis comparing by age, males versus females, or by our dichotomized race-ethnicity variable. This variable was dichotomized because of small cell sizes for certain groups, and such group dichotomization is the common procedure in smoking and vaping research. For JUUL use, there were no significant differences in lifetime JUUL use by age or sex. Interestingly enough, participants who identified as non-Hispanic white were significantly more likely to have ever used a JUUL. This is typical when looking at previous published studies of vaping research. Further, self-reported diagnosis of ADHD was 6.15%, lifetime JUUL use was 54.62%, 30-day use of JUUL was 29.90%, and 30-day frequency of JUUL use was 10.41. So what does all of this mean? Moving on to the discussion, once again, in the current study, 6.15% of participants self-reported previous ADHD diagnosis. Those statistics about previous ADHD diagnosis is consistent with the 2019 National College Health Association estimates of ADHD prevalence in college students. 54.62% of JUUL lifetime ever use and 29.90% of JUUL 30-day use were alarmingly high. Further, the statistics described once again means the first hypothesis that ADHD diagnosis was a significant predictor of lifetime ever JUUL use was supported, while the second hypothesis that ADHD diagnosis was a significant predictor of past 30-day JUUL use was not supported. We suspect this is due to the fact that the current study only asked for diagnosis and not symptoms of ADHD. As far as we are aware, the current study is the first to examine the relationship between JUUL specifically in regard to ADHD diagnosis. Further, examining the relationship between ADHD diagnosis and JUUL use specifically instead of just e-cigarettes in general. This is essential given the rise in JUUL's big popularity in today's society and in college campuses. By implementing JUUL-specific measures, the current study extends previous findings of Grant, Dvorsky, and Goldenson that were mentioned previously, because JUUL is an e-cigarette, which is relatable to those findings of ADHD diagnosis. JUUL is the big dog of electronic vaping products. Additionally, researching specifically about JUUL also fills in the gap of literature assessing the comorbidity of psychological disorders that are accompanied with e-cigarette use. The study compensates for a common limitation of previous comparable designs in which solely e-cigarette use was assessed. The limitations of the current study are as follows. Due to the design relying on convenience sampling, findings cannot be generalized to the population. Additionally, as it is a cross-sectional design, a temporal relationship between ADHD diagnosis and JUUL use cannot be established. The current study did not conduct a full psychological evaluation in which ADHD diagnosis was confirmed through diagnostic procedures. The current study has a relatively liberal threshold for ADHD diagnosis compared to the more restricted time frame for inclusion, such as 30-day symptomology. From looking at previous research and what the limitations are in the current study, future research could examine the relationship of current ADHD symptomology with JUUL use, or confirm that the diagnosis is current. Other pod-based devices, such as Fix and Sorin and novel disposable pod systems, should be further studied in relation to ADHD diagnosis. These newer devices are also gaining popularity.
Future research should assess alternate factors, such as socioeconomic status, in relation to ADHD diagnosis and JUUL use. Current research heavily focuses on adolescents, young adults, and university-attending participants. Further research could look into other age groups. This concludes Maddie and I's presentation on ADHD diagnosis and the association to JUUL use. Thank you to Dr. Seidman for his support on our many presentations at NAU, and to our viewers for taking the time to listen to our presentation.